show.
Welcome back to The Big Picture. We're talking with Dr. Raul Vazquez from G Health Enterprises about the coronavirus. Dr. Vazquez, some life-saving information could be as easy as calling you and your team if someone shows symptoms. They shouldn't wait. How early should they call and when should they call?
Well, we put protocols in place now. So if anyone as a worker comes in, they scan. If their temperature is elevated, then they have to be tested there and they go home. They're under quarantine. Yeah, so we actually put, we're trying to do what so we're going back to the Marcus Welbys of the world when people, if you were sick, we're seeing people at home. We're not bringing them into the office. And I think it's more precaution to the individuals and the patients that are here. So if you do have these symptoms, we're doing telehealth visits and then getting them tested and giving them all the information they need at home and also monitoring them for symptoms. When they call in, we're asking those specific questions, okay? And the questions are if they have fevers, cough, shortness of breath, in addition to any GI symptoms or any loss of taste and smell. So if any of these symptoms are happening, we're telling them to call us ahead and we're getting them tested and not bringing them into the office.
And the question is, or did we say, where do they call? Do they call your office or what number did they call?
Yeah, they call our office at 882-0366. That's our main office. And then we also call we have our nurse line number, which is the 604-0504. And the nurses can help to kind of direct that. But anyone that's sick, we ask them, and we also, when we call them to remind them about their appointment, we let them know to actually let us know so we can set up a telehealth, get them tested, and not have them come into the office.
Right, correct. Now, I'm sure you know this, many are making a political issue out of all of this with mask wearing and political party you're affiliated with and whether it's a symbol or not. And it's not the first time for that. So what would you advise people how to proceed? What should they do?
Well, I mean, this country above party, I think, we have to look at the fact that, politics does not play a place in science. You have to really look at the science. And, we all went to good schools and physicians, we're judged by what we say. There's a lot of liability that's there. We have agencies that monitor what we say. Office of Professional Misconduct can take your license away. So I wouldn't be saying these things if I didn't think that the data and the science supported it. That's a structure we created in medicine. And when you get sick, you're happy to have people like us doing what's right, not what's politically correct. And I think that's real important.
Right. Follow the science. Follow the science.
Yeah. Okay. And the masks are real important. I think the hand washing becomes crucial. I mean, the antiseptics are good, but soap and water are really good with this whole process. In addition to the social distancing, I mean, if you're around someone less than 6 feet for more than 15 minutes, consider yourself exposed to whatever that individual had. So you almost have to create a circle of trust. The people you live with, you're around all the time. So if you've been with them for over 2 weeks, 14 days, you're pretty much, it's a safe zone if you know what everybody else is kind of doing.
Well, now the big question is, what about opening schools? What are your thoughts about opening schools? Can it happen? How can it happen?
I mean, you have to follow the same rules that we're following from the medical side. If kids are sick, they shouldn't be able to go in. Checking kids' temperatures are very important. But the testing, without the testing, it becomes a real problem. And so if we can get these units that can test kids, and you may want to test everyone before they first come in to get a good assessment of those kids coming in. After that, if a kid develops these types of symptoms or has temperatures or has traveled or done something different that pose an increase in risk, then you really need to isolate and test these kids differently. You have to have the social distancing in the classroom, and masks are going to have to be worn by everyone in that classroom.
Some people say that life will never be the same, we will never be the same until a vaccine is released. What do you know about the development of a vaccine and how soon can it come? And is this a true statement?
Yeah, and once a vaccine comes, the new world order is that there are other coronavirus. So we're going to run into some similar issues unless we get a public health model that works well and that we have better primary care in some of these areas that are hotspots that were kind of looked at not getting the right proper services and ending up with the issues. So there's four types of vaccines that are being worked on. Some are what we call mRNA and DNA vaccines that really haven't been used in the past. With the two types that we used in the past was we take the virus, we kill it, and then we use pieces of it to kind of inject people with it, and people develop the antibodies towards it. Or we took a virus, and that's a lot of what we get with the flu shot. Then you have vaccines like measles, mumps, and rubella, and varicella, that we took the actual virus and we weakened it. And we're giving people a weakened virus, and that works well. So I think that the RNA one that's being worked on, we found out that in China back in November, they were actually using this new form of creating a virus called the RNA virus. And they had 45 individuals that worked for the company that took the vaccine. And they took 2 shots of that vaccine at the same time, develop antibodies. And now they've studied the antibodies to show that it is working within that model itself. But again, that's in China. Here, we're working similar types, and Pfizer and a couple of, so the United Kingdom, Pfizer are doing things right now. The government has already made an investment, as if you looked at it, of $1.9 million to come up with 100 million doses. What we're finding from that is that we're closer than ever to actually getting something. So I see us having a vaccine by December or January of this year.
I'm so happy to hear. Good. I'm happy
Yes.
to hear you say that, because it's so important. Everybody is so concerned and worried. What are your patients, medical teams, everyone saying to you about their fears and how everyone is coping with this pandemic?
Well, especially in an area of mental illness. I mean, we've had a lot of issues with mental illness, and everyone, to a certain extent, has been depressed because everything you normally do, you can't do anymore. Vacationing, anything that you did before this has really been paralyzed. And we've been in a home since January, some of us since January or March, for a long period of time, and it hasn't been good. So the only issue that lies with the vaccine is compliance. Right now, when I have the flu shot, and I almost force the patients to take the flu shot, because a lot of them says, well, I don't take that because it makes me sick. In this setting, I don't say you mandate it, but you got to have people that should be getting this vaccine, because you're going to have, again, politics above country, people that are going to say, well, this doesn't exist, I'm not going to get the vaccine. And that group of individuals is still going to be a problem for the ones that choose not to vaccinate. So we may still have the problem within that group. But then the ones that get vaccinated, they're going through the safety studies right now. At the end of this month, they're actually putting 30,000 people on it, more than what the study did for some of the studies. So we'll get that phase 3, phase 4 kind of model in order to look at the safety components so that people can get the shot. But from what I hear, and I've been reading the data out of Wuhan and some of these studies, it looks like if something would have happened, they started November, December, we're in July, we would have known a lot of bad things that would have came from whatever vaccine they came up with.
I'm so glad to hear something optimistic from you, Doctor, and I'm sure everybody that's listening is too. So finally, what do you think we can say to people about how they should remain vigilant still while this ongoing pandemic is taking place?
Yeah, no, the example is, if you look to the South, areas that weren't recommending masks and still aren't recommending masks, they're becoming the epicenters. I mean, Florida is an epicenter, and in some cases as bad as Wuhan when it first started. You have to really kind of consider we still have a problem. It's an invisible, agent. You don't know what you have. So if there's an area that's endemic, don't go there. Try to choose the locations that you go that are pretty safe. The social distancing, the mask, the hand washing, don't lose that. And actually, after this whole thing happens, and maybe we don't need the mask as much if the vaccine kicks in, the hand washing, things like that are still things that you should still do. It's not something that you should ever stop. And especially when people are sick, stay home. They shouldn't be coming in. So some of those models that we talk about, we should actually practice going forward.
Okay, now, I know we mentioned this before, but we should say again, how can people reach out to you? Let's give everyone your phone number and your website so they can, if they need to call you or if they want to reach you, they would know how.
Yeah, you can reach us at our office number, 882-0366. And we have our website, which is urbanfamilypractice, all one word.com. And if you go there, we have a lot of information there about contact tracing. We have applications like apps, Urban Family Practice app from the Apple and Android store. And in there, they have a COVID-19 survey. So if you have symptoms, you can fill it out. Our nurses get it. They'll reach out to you. We have a social determinants of health. If people are having trouble with food, they can fill it out and we figure out what we can do. And then we also have built-in contact tracing models. So if you are infected, we can actually help to figure out who else needs to be screened, checked to make sure that, that everything around you is okay also.
Dr. Raul Vazquez from G Health Enterprises Urban Family Practice and G Bond Health, thank you for your leadership. Thank you for helping us all get through these times. Thank you for your time with us here, and we hope to speak to you again soon. So remember, everyone, to be safe, follow the rules, and help one another. I'm Penny Wolfgang in for Phil Arno. Thanks for watching The Big Picture, and thanks for watching WBBZ-TV.